Chelsea from CDHF here. Hope you are all doing well and staying safe. I am here today with an exciting CDHF talk on infusion clinic visits for those with inflammatory bowel disease, or IBD for short. If you have recently been diagnosed with IBD and have been prescribed a biosimilar, or have recently switched from a biologic drug to a biosimilar, then this video is for you. As you may or may not know, most biologic and biosimilar drugs are administered by infusion, which typically means that the drug is given through an IV, where a short needle is inserted into a vein found in between the skin and muscle in the arm or the hand. In the past, you may have received a drug infusion at an infusion clinic. If you are newly diagnosed and new to this kind of treatment or drug delivery, we know you may have many questions. Similarly, if you have recently had to change infusion clinics for one reason or the other, you may also have a ton of questions about what the experience will be like at a new location. But never fear, CDHF is here. We will be answering all of your burning questions as we take you through a typical infusion at a real infusion clinic. So let's get to it.
When I have patients come into my office and they hear that they are going to have to switch to a biosimilar, usually the first concern they have is that they're going to have to give up their clinic and their nurse that they've maybe had for many years. Although they may be going to a new clinic, the Innomar and Bayshore clinics have actually been around for many years and are well-versed in patients with inflammatory bowel disease and their needs. And they have extensive experience in infusing all types of biologics.
When you first get introduced to the new program, the new coordinator, we want you as the patient to feel that any questions you have, that you can ask them freely and they will be answered. Reassuringly, what I found in BC is that most patients have found that the new infusion clinic is in similar locations, so similar convenience, and that they're not having to change their lives in order to get to the infusions. The protocols are all very similar in terms of making sure patients receive the care that they need with the appropriate standards in place. So again, recognizing that, of course, this is going to be a stressful process, but really, once you've had the experience of transitioning and having a couple of infusions, so far, the feedback from our patients have been very, very positive.
Changing to a biosimilar or changing to a new clinic or even being first time on these types of medications can be scary. And unfortunately, during our current times, we can't have you come in and tour our clinic, but I wanted to give you a little bit of information on what you can expect. So when the first time you come to our infusion clinics, you would be greeted by a nurse who would ask your name and do a screening for you for the COVID-19 to make sure that you're safe to come into our clinics. And we do that for all patients coming into clinic as well as our nurses.
So for patients, they may be transferring to a biosimilar medication and also transferring to a new clinic potentially. So we want to ensure and reassure that patients are aware that the infusion clinics will be set up in a similar manner. We have this similar support as other infusion clinics. We do also try to keep the same nurse with the same patient. So you'll establish a relationship with your nurse. You'll get to know your nurse over the weeks or months that you're on this medication or years. And you will also be able to receive the same sort of process.
We do have some clinics very close to downtown, but our goal here at Innomar is to be within 50 kilometers of 95% of the population in Ontario. So I'm pretty confident we'll have a clinic close to most patients.
48 hours before your appointment, you will receive a reminder call. During this reminder call, we will ask you additional questions for COVID-19 screening. This is in order to keep our staff and our patients safe.